Hand hygiene, the life-saving habit. Hand hygiene, or hand washing, is the process of cleaning hands with soap and water, or using an alcohol-based hand sanitizer to remove germs and prevent the spread of illness and infections. Key steps include wetting hands, applying soap, lathering for at least 20 seconds, rinsing thoroughly, and drying completely. This practice is crucial in healthcare to prevent healthcare-associated infections, HIEs, and is a fundamental way to protect public health by reducing germ transmission. Hand hygiene, often as simple as washing your hands with soap and water or using an alcohol-based sanitizer, is one of the most effective, affordable, and accessible ways to protect human health. Though it looks like a basic daily routine, in medicine and public health it is a cornerstone of preventing infections, reducing disease transmission, and saving millions of lives globally. Medical implications of hand hygiene. 1. Breaking the chain of infection. Hands are the most common vehicles for spreading germs. Every surface touched, from door handles to phones, can harbor bacteria, viruses, and fungi. Without proper hand hygiene, these pathogens easily pass from person to person, fueling outbreaks of illnesses like influenza, diarrheal diseases, and respiratory infections. 2. Healthcare-associated infections, HIEs. In hospitals, hand hygiene is a critical safeguard. Failure to wash hands between patients or before procedures spreads resistant bacteria, leading to severe infections such as MRSA, sepsis, and ventilator-associated pneumonia. Proper hand washing dramatically reduces hospital-acquired infections. 3. Food safety. Unwashed hands during food preparation transfer pathogens like Salmonella, E. coli, and norovirus, causing foodborne illness outbreaks that can affect entire communities. 4. Global health burden. Poor hand hygiene is linked to child mortality in low-resource settings. Many children under 5 die from diarrheal disease and pneumonia every year. Yet hand washing with soap could prevent up to half of these deaths. 5. Pandemic preparedness. During global crises such as COVID-19, hand hygiene became a frontline defense, reinforcing how this simple act protects individuals and populations from novel infectious threats. How to wash your hands. Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Scrub your hands for at least 20 seconds. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dryer. When to practice hand hygiene. After using the restroom. Before and after eating. After coughing or sneezing. After touching surfaces that may be contaminated. When your hands are visibly soiled or contaminated with blood or bodily fluids. Benefits of proper hand hygiene. Alcohol-based hand sanitizers. Use if soap and water are not available. Apply a palmful of the product to cover all hand surfaces. Rub hands together until dry. Note: hand sanitizer is not a substitute for washing with soap and water. Prevention of disease spread. Protects against gastrointestinal, respiratory, and skin infections. Reduced antibiotic resistance by preventing infections. The need for antibiotics decreases, helping combat antimicrobial resistance. It's a highly effective method for reducing the spread of harmful germs and preventing illness. Better maternal and child health. Clean hands. During childbirth and neonatal care, reduce infections in mothers and newborns. Community protection. A collective culture of hand-washing limits outbreaks and keep schools, workplaces, and healthcare settings safer. Economic advantages. Preventing disease through hygiene reduces healthcare costs, work absenteeism, and productivity losses. Summary. Hand hygiene is not just a personal habit but a public health intervention. It acts as an invisible shield against the transmission of countless pathogens. In hospitals, it is a professional duty. In households, it is a parental responsibility. And in communities, it is a collective safeguard. Conclusions. Hand hygiene is one of the most effective medical interventions ever discovered. Despite its simplicity, it requires consistent practice, awareness, and cultural reinforcement. It benefits individuals, healthcare systems, and entire nations. Action plan. 1. Personal level. Wash hands with soap and water before meals, after toilet use, after coughing or sneezing, and when visibly dirty. Use alcohol-based sanitizers when water is not available. 2. Healthcare level. Enforce the WHO's 5 moments of hand hygiene for all healthcare workers. Provide easy access to sinks, soap, and sanitizers in clinical settings. Audit and reinforce compliance through training and reminders. 3. Community and schools. Install hand-washing stations in public places and schools. Incorporate hygiene education into school curricula. Encourage children as hygiene ambassadors at home. 4. Policy and government. Support national campaigns promoting hand hygiene. Ensure access to clean water and soap as a basic human right. Integrate hand hygiene promotion into pandemic preparedness strategies. Final note: hand washing is not just about keeping hands clean, it is about keeping lives safe. Every drop of water and soap used for hygiene is a silent but powerful weapon against disease.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.